Let's dive in and learn how to keep your cat happy, healthy, and purring for years to come. Physical signs. When your cat's body speaks volumes. First up, changes in appetite. Has your cat suddenly lost interest in their favorite food? Or maybe they're eating more than usual? Both scenarios can be cause for concern. A decreased appetite might indicate dental problems, stress, or even more serious health issues. On the flip side, increased hunger could be a sign of diabetes or hyperthyroidism. What can you do? Try offering different food textures or warming up their meals slightly to make them more appealing. If the problem persists, it's time for a trip to the vet. Remember, cats are creatures of habit, so any significant change in eating patterns is worth paying attention to. Moving on to our second signal. Unusual litter box behavior. This one's a bit icky, but it's crucial to monitor. Are you noticing your cat straining to use the litter box? Or maybe they're suddenly doing their business outside the box. These could be signs of urinary tract infections, bladder stones, or even kidney disease. To address this, first, make sure you're keeping the litter box clean. Cats are notoriously picky about their bathroom habits. You might also want to add an extra litter box or two around the house. The general rule is one box per cat plus one extra. If the problem continues, don't wait. Consult your vet. Our third signal is excessive grooming or scratching. Cats are known for their cleanliness, but there's a line between regular grooming and obsessive behavior. If you notice your cat constantly licking one area or scratching excessively, it could be a sign of allergies, skin irritations, or even parasites like fleas. To help your kitty, try using a flea comb to check for any unwanted guests. You might also want to look into hypoallergenic foods or consider if any recent changes in their environment could be causing stress. Again, if the behavior persists, a vet visit is in order. Now, you might be wondering, why are these physical signs so important? Well, here's the thing. Addressing these issues early can prevent more serious health complications down the line. That upset stomach could be easily treated now, but left unchecked, it might lead to malnutrition. Those litter box problems? Catching a urinary tract infection early can prevent painful kidney stones. By paying attention to these signals, you're not just solving immediate problems, you're potentially adding years to your cat's life. Plus, you're improving their day-to-day quality of life. These physical signs are their way of saying, "Hey human, I need some help here." By learning to recognize and respond to these signals, you're becoming fluent in cat communication. Behavioral red flags, decoding your cat's actions. Now that we've explored the physical signs your cat might be showing, let's move on to some behavioral red flags that could indicate your feline friend needs help. These following two signals are all about decoding your cat's actions and understanding what they're trying to tell you. Signal number 4. Increased aggression or hiding. Has your usually friendly cat suddenly become a hissing, scratching ball of fury? Or maybe your social butterfly has turned into a recluse, spending most of their time under the bed. These behavioral changes can be alarming, but they're often your cat's way of saying something's not right. Sudden aggression might seem like your cat's just having a bad day, but it could actually indicate pain or fear. Imagine having a toothache. You'd probably be a bit grumpy too. Similarly, a cat with joint pain or an injury might lash out when touched because they're hurting. On the flip side, excessive hiding can be a sign of stress, illness, or even depression in cats. Remember, cats are both predators and prey in the wild, so hiding is a natural instinct when they're not feeling their best. So, what can you do to help? First, try to identify any recent changes in your cat's environment that might be causing stress. New pets, moved furniture, or even a different brand of litter can upset some cats. Creating safe spaces for your cat can help them feel more secure. Try setting up cozy hideaways in quiet corners of your home. If the aggression seems out of nowhere or is accompanied by other symptoms, it's time for a vet visit. They can check for underlying health issues and provide guidance on managing your cat's behavior. Moving on to our fifth signal, changes in vocalization patterns. We all know cats can be chatty, but significant changes in how often or how loudly your cat meows can be a cry for help. Has your usually quiet cat suddenly become a chatterbox? Or maybe your talkative tabby has gone silent? Both scenarios could indicate a problem. Increased vocalization, especially at night, might be a sign of cognitive dysfunction in older cats, or could indicate pain or discomfort. On the other hand, a decrease in vocalization, particularly in a usually vocal cat, could suggest they're not feeling well. Some cats may also change the pitch or tone of their meows when they're in distress. A normally soft-spoken cat suddenly yowling loudly could be experiencing pain or anxiety. To address these changes, start by paying close attention to when and where the unusual vocalizations occur. Is it happening near the litter box? Your cat might be having trouble eliminating. Does it happen when they jump up on furniture? There could be joint pain involved. For nighttime vocalizations, try creating a consistent bedtime routine for your cat. Engage them in play before bed to tire them out, and consider leaving some interactive toys out for nighttime entertainment. Remember, any sudden or significant change in your cat's vocal patterns warrants a checkup with the vet. They can rule out medical issues and provide advice on managing behavioral causes. Dealing with behavioral changes in cats requires patience and understanding. These aren't just random mood swings. Your cat is trying to communicate something important. The key is to approach these changes with empathy. Put yourself in your cat's paws. If you were feeling scared or in pain, wouldn't you want your loved ones to notice and help? Subtle shifts, the easy-to-miss signals. Now that we've explored some of the more obvious signs your cat might be crying out for help, let's turn our attention to two subtle shifts that are easy to miss but incredibly important. First up, changes in sleep patterns. We all know cats love their naps. But did you know that significant changes in how much or when your cat sleeps could be a cry for help? Maybe your night owl has suddenly become an early bird, or your once active kitty is now sleeping the day away. These shifts can be easy to overlook, especially if they happen gradually. Why are sleep changes so important? Well, alterations in sleep patterns can indicate a variety of health issues, from pain and discomfort to more severe conditions like hyperthyroidism or cognitive dysfunction in older cats. It's like when we have a terrible night's sleep. It affects our whole day, right? The same goes for our feline friends. To keep track of your cat's sleep habits, try noting when and where they usually nap. Do they have a favorite sunny spot in the afternoon? A preferred cushion for their evening snooze? Once you know their routine, it'll be easier to spot any changes. If you notice your cat sleeping in unusual places or at odd times, it might be worth investigating further. What can you do if you notice sleep changes? Start by making sure your cat's environment is conducive to good sleep. Ensure they have quiet, comfortable spots to rest, away from noisy areas of the house. If the changes persist, it's time to chat with your vet. They can help rule out any underlying health issues and provide guidance on improving your cat's sleep quality. Moving on to our final signal, changes in water consumption. Have you been refilling your cat's water bowl more often lately? Or maybe you've noticed it's staying full for longer than usual? Both increased and decreased thirst can be signs that something's not quite right with your feline friend. Increased water intake, also known as polydipsia, can be a sign of several health issues, including diabetes, kidney disease, or hyperthyroidism. On the flip side, decreased water consumption might indicate dental problems, nausea, or even depression. Monitoring your cat's water intake might seem tricky, but there are some simple ways to keep track. Try marking the water level on the bowl with a permanent marker or using a measuring cup to fill the bowl each time. This way, you'll have a clear idea of how much water your cat is actually drinking. If you notice significant changes in your cat's drinking habits, don't wait to take action. Increased water intake, in particular, can be a sign of serious conditions that require prompt veterinary attention. Your vet might recommend blood tests or urinalysis to check for underlying issues. Now, you might be wondering why these subtle shifts are so crucial. Think of it like this. Noticing these subtle shifts is like catching a small leak before it becomes a flood. By picking up on changes in sleep patterns or water consumption early, you might be able to detect and treat conditions like diabetes or kidney disease before they become more serious. This early detection can lead to better outcomes, potentially adding years to your cat's life and saving you stress and veterinary bills in the long run. Your role in your cat's well-being. We've covered a lot of ground, from changes in appetite to subtle shifts in water consumption. These 7 critical signals are your cat's way of saying, "Hey, I need help." Remember, you know your cat best. If something feels off, trust your instincts and don't hesitate to consult your vet. By recognizing these signs, you're not just a cat owner, but a cat whisperer. This knowledge empowers you to provide better care and catch potential issues early. Your feline friend relies on you to be their voice and advocate. So, what's your next step in becoming the best cat parent possible? Keep learning and observing. Your cat will thank you with purrs and cuddles. Speaking of learning, are you curious about what your cat is saying? Check out our next video, 12 Things Your Cat is Trying to Tell You. Thank you for watching.